collaboration with the Cyprus Mail, this is the Cyprus News Digest with Rosie Charalambous.
Coming up this week, as the EU marks Antibiotics Awareness Day, we hear from the Health Commissioner about the ticking time bomb that is antimicrobial resistance, killing some 25,000 people every year in Europe alone.
Use of antibiotics like growth promoters, and of course in prophylactical terms, especially in poultry industry, is very dangerous.
And we look at how the EU is tackling the problem.
There's still much more to be done. The first step is to ensure that there is awareness, not just about the problem itself, of course that's very important, but also what people can do and what they should not do.
In the wake of the Paris attacks, the European Union's High Representative for Foreign Policy announces a new approach to neighbourhood policy.
It is with Paris all of Europe that is attacked, but it is not only Europe that is attacked. It's somehow our common roots, our common civilizations, jointly, that are attacked.
And Amnesty International publishes a new report on the failings and dangers of Europe's response to the refugee crisis.
The main issue is people are escaping from persecution and violence, and as long as they do not have any other options, they will continue making these journeys.
To mark European Antibiotic Awareness Day on November the 17th, the European Union Health Commissioner, Vytenis Andriukaitis, spoke to selected members of the press at the Berlaymont in Brussels.
My priorities are in line with prevention, promotion and protection issues. Of course, speaking about 25,000 deaths, infectious diseases are preventable. Of course, we must follow strict hygiene rules, sanitary rules, strict rules in hospitals and so on, but also we must say that our society must understand society also is actor related to those 25,000 deaths, because misuse of antibiotics, overuse of antibiotics, it creates huge problem to all of us. And lack of prevention and lack of protection in this situation is very clear. And of course, I want to protect European citizens from serious cross-border health threats, such as flu pandemics or foodborne illnesses. Turning to prevention and promotion, we have for too long focused primarily on care and cure, while most of harm-related risk factors, such as alcohol, tobacco, and obesity, and other issues are preventable. And of course, speaking about possibilities to use such antibiotic awareness day in favor to support our own one health quality approach related to antimicrobial issues, in encouraging all actors to create common network of actions, encouraging all member states to draw their attention on national action plans in relation with antimicrobial resistance.
I asked the Health Commissioner about the lack of awareness of the impact on human health of the prophylactic use of antibiotics in farm animals.
I fully agree with you. It is very dangerous to see that antibiotics are using in prophylactical goals, especially in farming area, but not only in farming. As you know, in some countries people use antibiotics when they have virus, but they think that antibiotic can help them if they are affecting from virus infection. But pressure from society to medical doctors is very high in some countries. And of course, speaking about veterinary sector, in veterinary sector, we see that use of antibiotics like growth promoters, and of course, like in prophylactical terms, especially in poultry industry, is very dangerous. And we introduced a new proposal from European Commission side. So today we are seeing two new legal pieces, medicated feeds and veterinary medicine. It is in discussions between European Parliament and Council at the moment, and there we are introduced ban of use of antibiotics in prophylactical goals. And as you know, I would like to say that about 2.5 tons of antibiotics are used in farming sector every year. It's a huge amount. And if you see in some areas, you must bear in mind that we must speak not only about antibiotics and of course about dangers in direct to animals and direct to people, but speaking about environmental issues. As you see, some residuals of antibiotics are in the water on the ground. And especially in those areas where concentrations of farms is very high. And you must bear in mind, you must invite all scientists, especially those who deal with environmental issues, to draw their attention and evaluation of environmental issues in those areas. And we introduced very strong positions to banning use of antibiotics in prophylactic goals. It is ongoing. 2 new pieces of legislation.
EU Health Commissioner Vytenis Andriukaitis. After the Commissioner's briefing, I spoke to the health spokesman Enrico Brivio, who outlined the message that the Commission was trying to get across on Antibiotic Awareness Day.
Well, that it's very important to limit the use of antimicrobiotic pharmaceutical to the targeted cases and to avoid, if not ban, the prophylactic use role in the animal farming.
And that's something that's very worrying for most people, because I don't think they're aware that there are very high levels of resistant bacteria in the food we eat, not just in animals, but also in some cases in vegetables. That's not something most people are aware of.
Yes, that's the problem, as Commissioner Andriukaitis underlined, that people don't know that there are 25,000 deaths every year that can be attributed to the resistance that we developed in several forms to antimicrobiotic medicine. So this is as a cost for Europe of 1.5 billion. This is a challenge of a scale and complexity comparable to many other important challenges. And we have to be aware of this, and there has been awareness in all Europe, and we are promoting a plan at European level to promote awareness on this, and we will also support member states to have a national plan to develop this awareness among citizens.
I think doctors are getting a little bit better now at not being so free to give out antibiotics to humans. But if we go back to this prophylactic veterinary use, particularly in farming, there are plans, I think, in the pipeline to ban the routine feeding of antibiotics to farmed animals. How long before that becomes something that we can all say, OK, if I eat this, I'm not just absorbing more antibiotics? Yes. And let's not forget the environmental impact. For example, if you look at the water samples in our rivers and our lakes, because of this use for so many years, there are antibiotics in the water we're drinking.
Yes, yes. As you said, there are some proposal now, which has been analysed by the Council and the Parliament on the basis of proposal of the European Commission to ban or strictly limit this this prophylactic use in farming for the exact reason you said, to avoid the spread of this antimicrobic medicine in the water, in the environment, and that this increasing resistance of human beings. So on top of the plans to grow the awareness, to also some new legislation to limit or ban, if possible, and to restrict to very limited case where it is really needed, the use of antimicrobiotic also in animals. And so what we have to work is on promotion, prevention and protection in this field, and that's what we're going to do.
The EU Commission spokesman for health, Enrico Brivio.
Keep up to date with events in Cyprus and around the world with the Cyprus News Digest.
Staying with the issue of antimicrobial resistance, or AMR as it's known, which experts say is a ticking time bomb that could impact us all in the near future unless it's tackled now. I asked Marianne Donker, who's the Deputy Director General for Public Health in the Netherlands, how their holistic approach to AMR had achieved a 50% reduction in antibiotic use in farms, with a subsequent decline in resistant bacteria bacteria in pigs, chickens and dairy cattle.
Well, I think we were already doing very good in the human health sector. We had low levels of antibiotic use, but we really were doing very bad in the animal health sector. And so we really took that head on in the past 5, 6, 7 years, and we targeted the health sector in many different ways. We tried to reduce the prescriptions of antibiotics by, for instance, making it mandatory that antibiotics are only prescribed by the veterinarian, and the farmer is no longer allowed to have antibiotics on his farm anymore to distribute them on his own. We also established a very strong regulatory and monitoring system in the Netherlands to really look at how much antibiotics is prescribed in each farm and how much antibiotics is prescribed by each veterinarian as a person. And this is monitored and also judged, whether it's too much or in a good
Of course,
example.
there are
Yes.
different types of antibiotics dealing with different types of problems and creating different types of resistance.
Yes.
So are you able in any way to monitor the effectiveness of the measures that you've taken? Because I noticed that in the graphs we've seen, some resistance of certain types is much more prevalent in some countries than others. And I presume it's very important to track all of that to know how these measures are actually working.
Well, tracking and monitoring very thoroughly and very precisely. What we saw on the whole is that we reduced the prescription of antibiotics in animal husbandry by 58%. We can also see the different antibiotics apart. So for the fluoroquinolones, we see a reduction of 25%, which is a little bit less. But those, of course, are the third generation antibiotics that are always very reluctantly prescribed. The prescription of those antibiotics is very restricted. And we did see in the Netherlands that the resistance of bacteria also was reduced in animal husbandry we think due to our measures. So not only prescription of antibiotics, but also the occurrence of resistant bacteria in the animals is less now than it was many years ago.
Which people perhaps don't realise passes itself on to humans. And the whole point of this, isn't it, is that human beings in particularly possibly life-threatening situations, if they carry some of these resistant bacteria, won't be treated effectively by the last line of the doctor's possible resort, as it were. How many people do you think understand that the food chain is actually a very important part of this?
Well, we're looking into that. I think the food chain is a matter of concern in the Netherlands, also in the general public. But how this precisely works, transmission of resistant bacteria through the food chain, of transmission of antibiotics through the food chain, we are actually not very clear about. So we do have a large research program to get a better picture of where the risks really are, and then we can really tackle those risks, of course, in measures. But it's a not so clear subject at the moment.
Marianne Donker, the Netherlands Deputy Director General for Public Health. At the launch of European Antibiotics Awareness Day, the Deputy Director General of Santé, the Directorate General for Health and Food Safety, Martin Seychelles, spoke about raising awareness and tackling AMR. Afterwards, he told me how the EU was trying to get across the message that this is something that should concern us all.
Well, first of all, I think despite the fact that there is certainly some positive trends, we've heard about the positive trends, there's still much, much more to be done. The first step is to ensure that there is awareness, not just about the problem itself, of course that's very important, but also what people can do and what they should not do. This applies to everyone, so the general public, of course. We've heard about sometimes the pressures that are put on doctors to prescribe. And then, of course, on the various professionals, doctors, nurses, pharmacists, veterinarians, who all have an important role to play. So communication is absolutely key, because the first step to overcoming a problem is understanding the problem, making sure that everyone understands the problem. And then we can find solutions to that. We have to keep in mind that whatever we do in policy, will only work if people understand why that policy is necessary and therefore support it. Otherwise, a lot of reforms remain on paper. So this is clearly why dissemination is important, and it's not just an annual event to have a calendar, but also to make sure that we remain focused on this issue.
But it is something that is left up to national governments within the EU, and that seems to be a little bit of a problem in the sense that some are taking this very seriously and others possibly have it on a back burner.
It could be a problem, but it does not have to be a problem, because one of the big advantages of the EU is that we have the opportunities not only to discuss things together and have aspirational documents, but we can also identify, first of all, how we can learn from each other, identify good practices, best practices, etc., and then also support national policies with the right kind of evidence, with the right kind of sometimes even legislative policy, financial tools in areas where this is relevant. And I think member states are also realizing the added value of working together. After all, this is a common problem. And as we have seen, it's a problem which can easily spread from one country to another. So there is a great deal of, let's say, added value and things to be gained by actually identifying what can be done, what is being done, and what needs to be done. And then, of course, the international dimension. Europe is much, much stronger when we are able to speak in the international arena with one voice on an issue on which we all agree we need to speak with one voice, and this is certainly one of them.
But there does seem to be a north-south divide.
There does, although of course I'm more concerned ultimately about the trends. So I was looking more attentively at the trends. So in some areas there are positive trends, problem is being brought under control. In other countries, this is still not the case. I think we need to discuss what we need to do to support those countries that are still finding difficulty in bringing this problem under control. And this is true. It's true there's a north-south and sometimes also west-east problem. We should not neglect that dimension as well. But let's also not lose sight of the fact, as we have seen the figures from the United States, even in the US they have big divergences. This is normal, and therefore I think we have to find ways of working with those countries, those regions that still have the longest way to go. Because ultimately this problem is not going to remain there, it will spread.
Martin Seychelles, Deputy Director General of Santé, the Directorate General for Health and Food Safety.
You can subscribe to the Cyprus News Digest on iTunes for free and get the program downloaded to your phone or tablet so you can listen anytime, anywhere.
While I was in Brussels, Federica Mogherini, the High Representative of the European Union for Foreign Affairs and Security Policy, announced the results of a review of the European Neighbourhood policy, spelling out the bloc's new approach to its eastern and southern neighbours.
We need to shift from an approach that was based on the assumption that we have a European Union at the centre and neighbours around us approaching more or less to us, to a vision based on a partnership among equal partners that have common problems, in some cases common opportunities, and that need to build instruments and platforms to work together in an effective way, both on the challenges and on the opportunities. In the neighbourhood, we are sharing the same kind of security threat. So that's also why I said, also yesterday, together with the French Defence Minister, Jean-Yves Le Drian, it is with Paris all of Europe that is attacked, but it is not only Europe that is attacked. It's somehow our common roots, our common civilizations, jointly, that are attacked. And we are in this together, offering economic development opportunities, building jobs, and not only educational, but also adequate jobs for the youth of both the Mediterranean region and the east of the European continent is crucial also for the stability and the resilience of the countries and the societies, and so of the European one. ENP didn't include security instruments so far. It was not a focus. It is quite obvious, I think, today that we have to include instruments that provide us tools on which we can work together with our partners, both in the East and in the South, building more resilient countries and societies to external and internal threats. On the protection of refugees, working more and more with our partners to strengthen their own and our own also, but this is again for our side of the story to be told, but strengthening their capacity to protect, to welcome, refugees and guarantee that their asylum systems and their protection systems are strengthened.
The EU's High Representative for Foreign Affairs and Security Policy, Federica Mogherini.
Get in touch with the Cyprus News Digest by emailing cyprusnewsdigest@gmail.com.
Fear and Fences, Europe's Response to Keeping Refugees at Bay. That's the title of a report released by Amnesty International on November the 17th. The report's author is Irem Arf, Amnesty's European migration researcher. Irem, what actually were the main conclusions of the report?
The main conclusions of the report is that although EU and its member states have signed into the Refugee Convention and have obligations towards refugees, what have been happening at Europe's external borders is that they are trying to prevent any arrivals and have any responsibility towards refugees in the midst of a global refugee crisis. This is done through various measures that they employ at borders, including security measures and also operational cooperation with neighboring countries. And also it includes mainly pushbacks that our report talks about of migrants and refugees who arrive into Europe being sent back to where they have come from completely in an unlawful manner.
Now, this is partly to do with the safe countries list that I think Europe has drawn up. But what do you term a safe country? Some of them may be physically safe, but they're certainly not places where you or I would want to live, for example. So what's the agenda there?
There's currently no common list of safe countries in the EU, but there are processes that are trying to develop this. But several countries within the EU have already adopted lists. For example, Hungary, which includes country lists for countries of origin that are safe and also third countries that are safe. These concepts are quite concerning because refugee assessment, the identification of someone's international protection needs are individual. People need to go through a process, and everybody in the most safest country one could imagine, there are still refugees who need to escape from, who face persecution. So drawing up a list is quite scary. And additionally, these country lists are accompanied by accelerated procedures with less safeguards, which means certain nationalities of refugees are facing limited safeguards than other nationalities and in that sense facing discrimination.
And then of course there's the deal with Turkey. We're not sure exactly how that is going to be implemented. In fact, we're not really sure what's gone through between the European Union and Turkey. But the whole idea seems to be to keep people where they are, and it hasn't addressed the problem of the smugglers, which means that as we see in the seas between Turkey and Greece, particularly with winter upon us, that they're actually taking even more dangerous journeys than they were a few months ago.
Mm-hmm. Yes, there is a draft action plan between EU and Turkey, and it does mainly focus on preventing arrivals. There is very little and nothing concrete on ensuring access to Europe for refugees. Turkey currently has over 2 million Syrian refugees and also on top of that other refugees from various countries. And recently we had several cases of people who have been apprehended at Turkey's borders from Syria and Iraq being forced to go back to Syria, for example. And these are very concerning. These human rights concerns are real, and the action plan and also cooperation arrangements that exist between other EU member states and other third countries do not consider these concerns. And additionally, with land borders being closed, people are forced to take more dangerous journeys. Refugees do need to go to safety. So they will continue on making the journeys, and as land borders are more and more inaccessible, they will be forced to take more dangerous routes at sea and even at winter times, as you said, and have to pay smugglers and put their lives at risk in the hands of criminals.
The EU did draft its own 17-point action plan that laid a great emphasis on better communication between the different European countries so that they had a much better idea of who was coming into where and how to manage the infrastructure to deal with this. Now, I know that it's something that's ongoing in a sense, but does Amnesty think that that is going to in any way tackle the problem?
There is definitely a need to address the gaps at main entry points. We see hundreds of thousands of people have arrived already on the small Greek islands, and there is a need to ensure adequate reception at those entry points, ensure identification of people in need of protection and the other vulnerabilities. And this needs to be done with all EU member states' participation. This can't be just the responsibility of EU. There are talks and conversations on managing this. However, unfortunately, so far, we don't see all the necessary resources being diverted to these main entry points.
And there is a feeling on some of the Greek islands that in actual fact things are not being made more comfortable for those who have arrived because they think it's going to encourage even more people to come.
Various concerns about pull factors have been raised, for example, with regards to search and rescue operations in the central Mediterranean as well. And what has the numbers of people arriving over the last few years has shown is these factors are not real. The main issue is people are escaping from persecution and violence. And as long as they do not have any other options, they will continue making these journeys. It's not about providing the adequate reception that would encourage them to make the journeys. They have to.
Finally, let me ask you, in the wake of the Paris bombings, and there were bombings, of course, in Beirut as well, do you think that the terror attacks in Paris are going to have a negative impact on Europeans' view of the whole refugee situation? Do you think it's going to bring on a backlash, especially since we heard reports that a passport was found near a terrorist body suggesting that he was one of the refugees? What impact is that going to have?
What EU leaders have to do is definitely separate the security concerns from the rights that refugees are entitled to. The refugee crisis is real. Globally, there are, as I said, over 19 million people displaced as refugees, and they have rights that they are entitled to. The concerns are real. However, if the entry points are better staffed, if there are an orderly receival of refugees, if their arrival is managed better, so there are better allocation of resources at these points, this would not only ensure that refugees have access to the protection they need, but also security concerns are addressed. People are identified at the entry points, and these security concerns are also identified. Additionally, we have been calling for increased safe and legal routes for refugees. One of them, for example, resettlement, which involves elaborate refugee status determination procedures, as well as security checks before people travel to their resettlement country. So if these things are addressed, this would also help address the security concerns states have.
That is the author of Fear and Fences, Europe's Response to Keeping Refugees at Bay, released by Amnesty International on November the 17th. Well, that about wraps up this edition of the Cyprus News Digest. Many thanks for your company. Hope you'll join me next week. Till we meet again, take care and God bless. Bye-bye now.